Welcome everyone. Thank you for joining us for the today's session. Let me introduce myself. I'm Kalai Selvi. I'm the event coordinator at Texila American University. So today we are going to discuss about the topic why and where to seek knowledge, the exigencies of public health acumen. So I'm glad to introduce the speaker of the day, Professor Femi Refos-Tinola, Texila American University. So here goes the short bio of the professor. Professor Femi Refos-Tinola holds an PhD degree in population health from the University of Ado, Nigeria, with additional training under the World Health Organization. Tropical diseases are in ethics and codes in research in public health. International People's Health University, Bangladesh. Tinola is currently a professor of pollution health at the Federal University, Gayasu, Zamfara State, Nigeria. So where he teaches and research in population health, rest of scholarship from many professional associations. He had attended and presented research papers over 80 learned conferences and professional workshops within and outside Africa. So Professor Tinola has over 70 academic publications and have research into social, cultural aspects, sexual and reproduction health of young women in Nigeria for about 2 decades. So today he is here to present on the topic why and where to seek knowledge, the exigencies of public health. So once again, we welcome you, Professor Tinola.
Thank you very much. I welcome everyone to this meeting. I'm delighted and I'm happy to be here at this time. And everyone too is good and happy to have joined this session where we share bodies of knowledge, where we interact, where we judge on the particular topic of public health relevance. I am delighted, like I said, to be here. I will try as much as possible to keep to time. I'm a teacher. I will try to lift myself. The slides are not much, but the explanations may be more, but I will try and stay within the limit of time. This session is supposed to last for about 1 hour. When it's about 15 minutes, so I will spend about 45 minutes. We'll give opportunity for interactive section for about 10 minutes, and then maybe later the coordinator will round it up so that we keep to time, and then we'll work to time schedule. That's also part of the training. Once again, everyone is welcome. Why and where to seek knowledge? The exigencies of public health. Generally speaking, in the academia, there are different ways of seeking knowledge. So if you look at slide 2, you will see the layout of this paper. In the real sense of it, the paper is divided into 4 sessions. Each of the sessions is loaded with a lot of information. And but due to time constraint, we'll be able to just talk briefly within the limit of time on topics, those topics and subheadings that have been listed here. The first thing is methods of knowing. How do you know that you know? Do you even know anything at all? Do we know anything at all? How do we know that we know? How do we know the extent of our knowing? What are sources of knowing? What are sources of our knowledge? Are they scientific enough? Are they reliable enough? Are they empirical enough? Are they objective enough? As sources of our knowing, we're going to look at that. Methods of knowing. Generally, we're going to look at methods of knowing. Then again, we look at science and public. Any correlation at all? Do public health practitioners adopt scientific approach in their research? How reliable are data obtainable in public health? How sustainable, how defendable? Can we see some element of subjectivity in what we garner in public health as researchers? These are issues we'll discuss under that section, section 2. We'll move again to specializations in public health. Yes, of course, everyone should have come to realize the fact that public health is a very bogus discipline. In the reasons of it, it has some areas of specialized universities in the world. We refer to it as a school of public health. Then again, just as a way of, so we're going to look at those specializations, and we're going to look at some of those specializations because of time limit to tell you what they do in those, the expectations from practitioners in those areas of specialization. So we're going to look at those ones so that as a student of public health, you come to realize the fact that these are the responsibilities that are required of you from the members of the society. That's what we're talking about public health. Public has to do with the people. Quantum of people, responsible number of people in a particular population at the point in time. In a nutshell, you are talking about public, you are talking about general population. You can even say that the concept of public, the concept public itself is synonymous with population. So what are the expectations of people from specialists? We're going to look at that. We'll pick some of those areas of specializations. We're going to look at some of those things. After that, again, we will try as much as possible to go to the last session, which is session 4, where we'll talk about the salient points all public health students should know. Well, here you find yourself in Texila American University doing a programming. What are those salient points that you should know, that should guide you as a public health practitioner? Irrespective of your areas of specialization, what are those points that you must know? Anywhere you find yourself, any circumstance you find yourself. After getting your degree in master's degree or PhD degrees in public health, irrespective of wherever you come from, irrespective of the country, irrespective of the political scenario in that particular country where you find yourself, what are salient points that you must know that are general to all public health practitioners? Irrespective of whether you are from developing countries or you are from developed countries or you are from underdeveloped countries. Certain things are basic about health. Of course, every one of us is aware of the fact that there is a general definition of given to us by the WHO, the World Health Organization. And as long as that definition emerges from that professional organization, that particular organization, the definition is general. And what is general about it? Everybody knows that the WHO defines health as a mental and social well-being of an individual, and not merely an absence of disease or infirmity. The definition is general. So irrespective of wherever you come from, irrespective of the political background, irrespective of the economic background of the country where you come from, or where you live or where you practice, there are salient points you must know as public health student and as public health graduates. These are issues that are very, very important. So that's where we're going to round up the lectures. When we get to that stage, we'll discuss that. So let's go back to the method of knowing. French philosopher, we later refer to as a sociologist, the founding father of modern sociology. We call him Auguste. In his, way of researching, of finding sources of knowing, he identified 3 stages of knowledge evolution. The first stage he identified is theological stage, philosophical stage, and the stage of positivism. According to Auguste Comte believed that looking at the historical epochs of human society, the origin of knowledge itself could be traced to the stage of theology or to theological stage. Theo means God in this case, the spirit, the supreme being that lives, that understands everything more than we do as humans, sees beyond what an ordinary man will see. So he was just trying to explain that there was a time in human society when almost all the explanations in human societies were based or were sourced from religious leaders. This is not a class to discuss religion. This is not a class to be talking about Christianity, Islam, Judaism, or other forms of religion. But the point this man was trying to raise is that there was a time in human society when almost every explanation people sought and people were actually looking for were got from the religious leaders. Then politically at that point in time, that was when we used to have these, these theologians trying to rule the society at that point. In this part of the world where I came from, a witchcraft, it is often a witchcraft board grew yesterday, and a small boy dies this morning. Irrespective of whether that boy suffer malaria or suffer infection, suffer diarrhea, whatever. People jump into the death of the boy this morning will be linked with the witchcraft board that grew yesterday, linking the death itself to witchcraft. At that point in time, knowledge, everything about health, everything about disease, people quickly interpreted that religiously. They interpreted those things religiously at those points in time. She was tilting towards the supreme being. But at the point in time, philosophers came and they began to ask questions. That's the stage of philosophy. People started asking questions. They started questioning the audacity of religion in providing holistic explanations to all events in human society. Several questions were. In fact, at that stage, we read in literature that there were more, nobody was available. Nobody was competent enough to answer some of the questions that philosophers were asking about the sources of knowledge. Nobody was going out. He knocked the first toe of his leg, the right toe of his leg on a stone. And somebody said, oh, that is bad luck. That means when the person goes out, he's likely going to be infected with one or two diseases. That is in the religious stage, the theological stage. How verifiable is that? These are questions that philosophers ask at the philosophical stage. So at the point in time when they ask questions, I told you it was just it was a stage where people ask questions more than answer. There were more questions than answer, and there were no people to answer those questions because philosophers, people refer to them as armchair thinkers. So they were asking questions, asking questions, asking questions. Somebody who has malaria this morning, and because a witchcraft board grew yesterday, and you are trying to link up with it. So how verifiable, how scientific is that? That was when that stage lasted for a very short period of time, and in academia we describe that stage as a transitional stage that later led to the emergence of another source of knowledge, which August Comte described a stage of positivism. What does that supposed to mean? The stage of positivism means a stage where people see and record as they see and what they see. According to him, what is positive is what you see, and it is scientific. Modern scholars have come to let us know or to convince us in a way that this stage of positivism is the stage of science. And that was actually what Augustine was talking about. That we reach a stage where rather than relying on the religious knowledge or knowledge from religious leaders or from philosophers, it is even better that the society has now moved to a stage where we see and we record. So it is what we see, what is pragmatic, what we see, that is recorded. And that is science, that is science. So according to him, he now has this belief that science remains the best option, best source of knowledge in whatever we are seeking information on. So if we are talking about infection in human society, he was advising, and he also believed that science could provide such. At the point in time, I don't want us to go deep into all those kind of reasoning until we get to some specifics in public health itself. But there was some modern explanation trying to break down the science thing, of what Augustine was trying to explain. The scholar said, well, there are actually ways through which we can get information. The first one is experience. Well, experience is something that cannot be bought in the market. You need an individual earns an experience. It takes a very long period of time before you can gain some experience on a particular issue that is relating to your health. It's just like there is a cloud formation somewhere, and that cloud formation is tilting towards this particular aspect of the cloud, of the sky. And one small boy comes out to say, no, oh, daddy, we're going to experience rain today. And daddy will say, no, small boy, come. No, you don't. You see, when you see this cloud formation and it is at this side, no, it will not result to rain here, except this cloud formation moves to this other side. That is when you experience rain. That is by experience. Another one is reasoning, while the third one is reasoning. There are certain things you ask yourself, and you begin to query as an individual. Ask whether those things are reasonable or not reasonable. Somebody is feeling cold, and then somebody in the village just try to put up fire, this firewood, and then boy, come and sit down here and warm yourself. Is that reasonable? Could that be a reasonable way of solving that problem? Even when the child could have been suffering from malaria, you see, warming himself very close to a body or a body of fire that one can. Yes, I'm there already. I'm making the presentation already. Is reasoning. And so later that graduated again to what we call research, scientific research. Breaking that one down again, experience. I've explained that personal knowledge and skill from encounters with facts and events. The other one is reasoning. That is where you bring in some ideas about logic. You have deductive logic, inductive logic, and even the combined approach. I'm a professor of population health. And in reasoning, somebody can come around to say, and I'm a short man. We're not really short or relatively short. Somebody can say all short men are good. All short men are good. Professor Femi Tinola is a short man. Therefore, Professor Femi Tinola is good. And somebody will ask us, is that reasonable? Is that justifiable? Can't we be charged for overgeneralization? For just arriving at that. These are some of sources through which people sought or people are still seeking to know about the events in the human society. The mystery of our existence here is that very many things happen, and then we begin to ask questions. They look so strange to us, and we have evidence now that science offers quality explanations to some of these things. Some of us were aware of the fact that at the point in time, coronavirus came, invaded almost all parts of the world, and the whole world was shocked was shut down for coronavirus. People ask questions. Why is it that this thing came at that point in time? Why is it that there were no cures at that point in time? Religious people will have explanation. People who reason will have explanation. But the quality explanation we could get, and which we're still getting to speak to you, is science research, knowledge through scientific research. And that remains the best way, the current or the most recent way or method of knowing. Now, having looked at all these kind of methods of knowing, let's look at science and public health. So what is science? What I've done in the first session is to let you know the method of knowing, and that science remains the contemporary. Science remains the most recent, factual, empiric way of knowing things. And so findings from research, finding from scientific research remains reliable and tends to offer real solutions to the problems that man faces in the world planet where we find ourselves. So the first question is, what is science? Any relationship between science and public health? That will enable us to know whether the approach we're using in any research in public health is scientific or not. If it is scientific, is it reliable? How do we go about some of this research work we do in public health? So the first question is, what is science? What we are seeing in bracket is positivism. Positivism refers to what I mentioned earlier, a concept coined by Auguste Comte, the French philosopher or sociologist, referring to the scientific ways of doing things. What is science? Science is an empirical knowledge based on empirical and scientific, or based on empirical and objective investigations. That is science. In the real sense, the science is the pursuit of reality. You want to know what is real. You want to know why invaded almost all parts of the world. And in the history of the world, I think for quite some times now, coronavirus remains. We're yet to identify any infection that took the whole world to stand still for so long a period of time before it could be conquered. Explanations are sought, and people are seeking explanations through empirical investigations, research, which later led to the discoveries and emergence, of some of these goals of science. For any scientific endeavor, it is to explain, to predict, and true. Why coronavirus was discovered? We all know. It's everywhere. It's online. In China, that was the first case was discovered there. Why did we discover it there? Why was the first case not discovered in another? Why not in India? Why not in China? Why not in America? Why not in Nigeria, where we are here? Why not even in Africa? And by the time this was discovered, why did this spread so fast like wildfire? Why is it that the rate of transmission from one person to the other was so high and was so frequent to the extent that almost all parts of the world has its own share that is proportionate to the size of its population? Why? What is the origin? Why is it so spread? Why is it that killed very many people within that short range of time? Where did it come from? Why was it so difficult for scientists to tame the spread and to ensure that it did not escape out of China? Will it be because of migration that people are voracious and people are looking forward to each or the other, and there is every need for them to travel from one place? Yes, that could be the answer. Our knowledge, based on the explanation we've got through science, it will enable us to predict, to say this is what coronavirus is all about. Between so and so period, so percent of people have been infected, and so between so and so period of time, there is every possibility that the infection could have increased to so and so prediction. In China, where it came from, it became at that point in time the highest killer disease at that time. It killed a very significant proportion of the population, most especially in the areas where it originated from. And then there were predictions that if this thing was spread to countries of the sub-Saharan Africa, that almost all the population would be wiped. There were predictions. Even though some of those predictions did not even come to pass the way they were predicted. What about control of health issues? How do we now control it? Based on our knowledge, based on our ability to predict, and then we now control the spread and to ensure that this thing does not spread beyond what we expect. What is public health? Public health is a science of improving community well-being through research, programs, policies, and education. So there is a link. The link is that public health itself is a science of improving community well-being. So in what we do in public health, we adopt the method of science, we adopt the empirical method in a way of improving the well-being of the members of a particular community. Don't forget, I told you, that WHO defines health as a state of complete physical, mental, and social well-being of an individual, not merely an absence of disease. The physical, that's your physiology. The mental, that is your psychology, your state of mind, your psyche. And then that is the other side is the social well-being. That is your ability to initiate and effect meaningful social interactions with other members of the community. So it's a science of improving the well-being, holistic well-being, through research, programs, policies, and education. These are core responsibilities of public health practitioners. Public health will focus on protecting the entire population and addressing public health problems. Don't forget, when I was talking about public the other time, I was trying to describe it as the general population. Any problem that or any health challenge that affects a significant proportion of the population is or can be described as a public health issue, because it is affecting a significant proportion of the population. Importance of, let's look at, let me bring this slide back. Yes. Importance of education about public health. Is it really important for us to be educated about public health? Are you even wasting your time trying to study public health in Texila American University? What is the importance? Why seeking knowledge about public health? We're seeking knowledge about public health, one, because it plays a critical role in health promotion, disease prevention. I used to tell students at times. I teach health and illness behavior at the master's level in my university. Yeah. Somebody manifests signs and symptoms of malaria. And I need to tell them, look, the first thing you do is to trace your way back to the previous 48 hours before you notice these signs and symptoms. You're a student, you are in your hostel, and then you, in an attempt to visit another person, you went somewhere to greet somebody. After greeting the person, you spend about 3 or 4 days, and then you come back. By the time you are back you have signs and symptoms of malaria. And then you say, oh, I have malaria. I cannot stay in my hostel. No, let me go back to my friend. Whether I will be going for treatment from this. I said, no, that is not correct. The first thing you do is you trace your way back to the previous 48 hours. Or where you stay, there was no mosquito bite. And by the time you move to your friend's place, that's where you got the mosquito. So going back to that place again, it's like multiplying, trying to make your problem complex. It is important in discovering the root causes of health problem and developing innovative solutions. That is what you learn. Or these are part of the things you learn as public health practitioners. What does it do? It creates public awareness. That is how you do that. That's how you carry that one along. That's why you carry this number D, importance of education about public health. That is how you carry it out. One, you educate community members. That is about risk and best practices for disease prevention. Yes, you are creating public awareness. Knowledge is very, very important as far as in a village where you see people, somebody is having an infectious disease, and then you see all of them. In some rural areas, it happens. And then there is only one spoon that every one of them is used to eat. This person will pick a spoon, then pick, if it is rice, pick the rice and eat, drop the spoon, another person will pick it again. They do that in the spirit of Gemeinschaft, as described by Ferdinand Tonis, the spirit of oneness, in the spirit of unity. Well, that is risky to the head. Somebody during a radio program said, no, my husband, me, myself, and my husband, we're one, and we're together, we do everything together, we eat together, and we even use toothbrush, the same toothbrush, to brush our teeth together. Describing that as love. But that is risky. Educating members of the community about the risks and the best practices for disease prevention. 2, data collection on incidence and prevalence of disease. When I got my first degree, the title of my research work was Incidence of Disease, Access to Healthcare Delivery System in a Rural Community. And I decided, I studied that with the aim of looking at, the diseases that were prevalent in those areas where the research was carried out, and to see whether people actually had access to healthcare infrastructures, whether the healthcare infrastructures available to handle such diseases were were competent enough to handle such in that particular environment. I need to be very fast now because of time. Identifying prevailing health issues in the community, hazard, infectious diseases, and potential outbreaks. Of course, we are well informed that some of these things, to a very large extent, may be community specific. It originated based on the record from the WHO from Wuhan. I'm talking in terms of coronavirus now. It's originated from that particular community. That means, why not in another community? So it is also important for us as the public health practitioner who collect data to monitor the disease spread and take necessary How is it spreading? What is the percent of the population infected? In the next 24 hours, 48 hours, how many people have been infected? And that will guide us. The data we obtain will guide us on how to take necessary steps at curtailing this of that particular disease. We identify prevailing health issues in the community. Of course, just like I've just mentioned, disease prevalence may vary from community to community. If we could say something originated from a community and is spreading to another community, that is also to tell you that the rate of spread may differ. The rate of infection may also differ by the rate of spread. You identify health hazard, infectious diseases, and potential outbreaks. We educate people on personal hygiene, healthy practices, and the practice of first aid. It's not in all cases that you have a health challenge, but there are certain things you do for yourself before you approach a health facility very close to you. And approaching a health facility is also determined by proximity. There are instances where somebody is infected and where the person can get competent medical personnel to handle. It may be in a facility that is about 6 or 7 hours drive. Where is this? These are responsibility. We identify hazard, infectious disease, and potential, and we also educate people on personal hygiene, healthy practices, and first aid. Thank God for coronavirus. It was during this coronavirus. In a research work we were doing of research, somebody came and said, "Sir, we thank God for coronavirus." And I said, "Why?" He said, "If not for coronavirus, there's very many of them will go to farm. While coming from farm, they just see anything to eat. They just pick it and then they eat. Even this fruit, they just pick it and eat it without even washing hands." That there was a day he decided to stay at home without going anywhere. And after doing certain things at home, and he wanted to eat, and he just went there under a running water to wash his hands. You discovered that his hands were dirty. Now, for coronavirus, where this orientation came, that before you eat anything, you have to wash your hands and all those kind of things like that. These things happen in rural society. These things happen in rural communities where people are not really organized. We're improving on health care access and promoting health service delivery. If you have issues, public health practitioners will tell you, for this one, this is the hospital you approach. There are levels of healthcare delivery system. There are levels of health infrastructures. Of course, we know we have the primary, we have the secondary, we have the tertiary. The secondary is supposed to be what we call referral, or even the third. The tertiary is supposed to be referral. Some of this information, because public health practitioners are very close to the people, they offer this particular advice, and they try as much as possible to see how they can make policies and regulatory initiatives. They guide government. They try to explain to government by developing plans and policies and regulations to improving on community health. They stand the gap between the policymakers and the people, even though at a particular level, they are also involved in the practice of community wellness programs by providing vaccinations, conducting health surveys, and distributing medical supplies. I've just mentioned that. Public health practitioners are very close to the people. And because of their closeness to the people, they are often used by policy makers in providing vaccinations, conducting health surveys, and distributing medical supplies to the people that are vulnerable to particular disease or infection at the point in time. They conduct research for serious illness solution. They identify potential threats to community. They do. They also act in most cases as counselors. They act as counselors. That is a public health practitioners. I'm trying to be very fast. So these are responsibilities. These are things that you expect from somebody who has education, who has a training in public health. The summary of it all is to render services that will ensure and guarantee the health and the wellness of the population. And that is why you are here. Because I understand that there are some of you that are master's program or whatever who may not necessarily have a first degree, but because your qualification is relative, maybe your degree can be described as a sister discipline to public health, and then you are given admission. So these are things you're supposed to do. So what are specializations in public health? The first one is epidemiology. Epidemiology, we all know, is the study of disease origin and causes in the community. Just like I mentioned coronavirus. We also mentioned the issue of even Lassa fever. That is very common, very, very, very common here in Nigeria. Lassa fever originated from a village they call Lassa in Borno here in Nigeria. So, and the infection after that village, that is why you call it Lassa fever. Some of this information are gotten by epidemiologists. which is an area of specialization. The role of epidemiologists in investigating they investigate health problems and the outbreaks. As the Lassa fever was discovered in Nigeria in 1969, people thought it was just a disease for that particular environment. As I speak to you, almost all part of the country recorded one case or the other, or some cases that are even proportional to the population of Lassa fever. The latest report that we got indicates that more people die of Lassa fever in Nigeria, even than the coronavirus that was globally celebrated. Some of this information we got by epidemiologists. Environmental health, an area of specialization too, that examine the interaction between the environment and you may not need anybody to tell you that you are a product of your environment. You're a product of your environment. So if I come to your house to greet you, so if I look at the environment where you live in the house, because there are consequences, there are the inability of man to control the environment, result into some of these diseases that we're talking about. We'll focus on physical, chemical. No, I was teaching some students not quite long. I told them that here in Nigeria, most especially in the rural areas, by the time you are building a house, you're also building a room for rats. We know that Lassa fever infection, the primary host, the reservoir is the multi-mammoth rat. And this multi-mammoth rat, they live among the people. By the nature of the way people build houses here, you're building a house, you're already building a room for the rats. You can go to some of the universities, by the time you go there to teach, there's always a wall crack somewhere, an outlet for rats to come in and do whatever I told them, you are inside your kitchen, by the time you are cooking your kitchen, there is one rat because of the provision, because of the nature of the houses will be there. There's one rat sitting down somewhere trying to wash you. By the time you are done, that was in the evening, by the time you are done, rats, they see in the night. By the time you are done with your cooking and everything you are going, one rat will not come and say, oh, that man has gone, oh, that woman has gone. Let me come and chop part of my own proportion. So if there are things that are opened, that are carelessly closed, that are not totally closed, there's this symbiotic relationship that I was trying to tell the students. Symbiotic relationship between the rats and humans as far as this part of the country, this part of the world is concerned. And here we are talking about Lassa fever. You see people spreading cassava on the road in an attempt to dry it. It will be there for several days. Rats will come there, will dance, will fight, and then with one another, will defecate, will urinate on it. And these are some of the things that people don't even wash again before they cook and eat. All these things are consequences of our inability to manage our environment. Health administration, there is more to say. The time is very, very short. Very, very short. Let me just give myself the next 5 minutes. What about health administration? In health too, of course, we'll see health. We see health as as a structure. There's always an organization for administering health in every country, either at the primary, either at the secondary, either at the tertiary level, and that requires some levels of leadership roles in all these healthcare organizations. There you also see public health in charge of that particular aspect, environment, organization. Number 4 is community health. Of course, everybody understands what community is talking about. Just looking at the whole society generally. It can be conceptualized as a group of people living in a particular area at a point in time. It can be conceptualized as the total sum of people who have a particular view, an idea. I asked him, now there is coronavirus. He said, yes, we're told there is coronavirus. So, but the vaccine is out. Have you taken any of it? He said, no, I've never taken the vaccine. So, when are you going to take it? He said, no. I'm not going to take any of the vaccine. And I asked the question, why? He said, I am not going to take the vaccine because generally, what they call it's not really coronavirus, but it's something that has happened in our society long ago. Anytime you have that kind of experience, anytime you have that kind of feeling of infection, there is always a harm that that's the belief of that category of people. That category of people can be described as a community. And that is why you look at it, you can look at it from the perspective of geographical location, from the setting, and even the social interest. Somebody said they will never take coronavirus vaccine because because the president of Nigeria came out to say that people should take it. And I asked question, is that why you will not take it? He said, yes. And I asked further, can you please explain to me? He said, because he cannot trust the president of Nigeria, that is the former president, Muhammadu Buhari. He said he cannot trust. The moment Buhari can just put poison inside something for anybody to just drink and die. That is his own opinion. And we can refer to them as community. So the question now is, how do we now handle this particular community? Look at the issue of health policy and management. In bringing up policies that have to do with management of health. Yes, there is a specialization in public health that are competent enough to handle such. And of course, if not for time, I will have told you that we have short-term policies, medium-term policies, and long-term policies. Any policy on health that is less than 5 years is short-term. Anyone between 5 and 10, that is medium. Anyone that is more than 10 years is long-term. Policies affecting the life of the people. If you look at some of these things, my time is far gone. It's gone. I just have about 2 or 3 minutes more. Some of these specializations that I've mentioned here, you will see their roles. On slide 9, you see the role of epidemiologist. On slide 10, you see the role of environmental health specialist. Some of those things I mentioned, I decided to break it down so that at least we can understand better. Here you see the role or the functions of a healthcare administrator. And then here you see the focus of a community health specialist as an area of specialization in public health. Let me just leave those ones, believing that the slides will be made available to all of you at the end of this lecture so that you can just read through and understand why you are here. But I want you to ponder on this before I start. That is what a wealthy population is a very rich population. A wealthy country is a rich country. Health translates to wealth. There's no doubt about that. A population where most people are infected with several diseases and they are so incapacitated physically. Of course, you see the consequence on their health. Public health is a unique discipline, whether you like it or not. It is the discipline that it is the most relevant. I'm sorry to say that without any apology to people in other areas. So public health is the most unique discipline. Public health practitioners are unique. Public health any trainee in public health offers unique services for the physical, mental, and social well-being. So studying public health in Texila American University is a very, very unique opportunity. That will not permit me to go into reasons why I made this kind of statement, most especially the last one. I'm restricted to end the lecture now. Thank you very much. Let me just give you some 5 minutes to just ask 1 or 2 questions, and then we'll close this session. I think the university will make the slide available to all of you so that at the end of the day, you'll be able to read some of those things I have not been able to explain due to time constraint. I also want to say this, just in case you need any further explanations on some of these things that I've just explained. My email is there. You can contact me personally. I work for Texila American University in the School of Public Health, and I've been with the university for a very long time. And I'm ready at any point in time to offer quality services to whoever will come from Texila American University. So my email is there, and you can pick my email there. If there are further explanations, I think you can initiate at the personal level. I'll be ready to answer some of those challenges. I don't know whether we should give opportunity to some people now, either 2 or 3 persons to ask 1 or 2 questions. I'm trying to projection in full slide mode may be better when this is the end of the lecture. If you need the full slide, just send me your email, full document. I will forward the slide to you for your personal consumption.
I hope that is a question from Grace.
Yes, I'm trying to look at those questions now. The one that has been posted to see how I can. The first one here is, what is the difference between health administration and health policy and management? Well, there is in every human society, you have an organization that is responsible for administering health. And that is what I described the other time as organizations. So when you have, for example, a hospital is a form of health organization with a hierarchical structured, leadership, and that is why you cannot just get to any hospital and just parachute yourself into the office of the medical officer there. You have to go through a process because it is it is a formal organization. So in that formal organization, there is a process of administration going on there. That is where I refer to as, that is when I was trying to describe public health professionals as administrators. They can be the head. They can be given a training in public health will give you a better opportunity to head a particular organization where health is administered. Now, look at this. The other one is, you're asking for the difference. Health policy. Policies are made by stakeholders, and they affect the health and the state of health of individual for a period of time. And that was when I mentioned the issue of short term, medium term, and long term. Policies are made by government, all the stakeholders, and a training in public health will give you an opportunity. Because of course, it's not just a matter of making policies, but you make policies also develop a kind of structure that will give you the opportunity to those policies. There was a time in most of the developing countries that we're talking about health for all by year 2000. That was long years ago. When we go to year 2000, and then again the thing was shifted, and look at all these development goals. These are issues that are discussed when you mention the concept of policy. So health administration takes place in the health infrastructure, while health policy takes place in a holistic manner that will affect all the state of health of all the people in that part. So it's more or less in the last case you can say it involves government, it involves all the stakeholders, and then a training in public health will give you the opportunity to participate, and then to make useful suggestions and discussions as far as policies that affect what is more important.
Before we get into it, Grace is raising his hand. So Grace, you can ask your question.
Okay, thank you.
Yeah.
Okay, good afternoon, all. I'm Grace Bassi. I'm a PhD holder in Public Health Admin, Texila American University. Indeed, very, very grateful. In fact, the way you analyzed everything and the way you explained it, I was so fascinated, and I really thank you for that. And I was even rushing to jot down so many things, but I'm happy that you made mention that you make the slides available for each and every one of us that demands for it. Prof, once again, thank you very much. We are grateful. You have really opened my eyes, to why I'm reading public health, but so many of the things you made mention of, knowing science of public health and so on, and even talking about, I didn't really know that even theology had anything to do with public health. When you talked about the theological stage, and you started talking about also positivism, and maybe hitting of stone and things like that. Of a truth, in those days, when I blinked my right eye, I say, oh God, I hope I will not see any bad thing, and I'll start praying in tongues and so that, no bad thing will come my way, so hearing this again, I now know that public health is deep, it's really deep, not not the way I thought of. So thank you very much once again for it. Please, I want to ask again, when you were talking about the A part of science and public health, okay, and talking about the empirical way of knowing things and so on, so I don't know, maybe you can just lay a little bit of emphasis on it before we close again. And you also talked about the B part, goals of science, explanation and predictions and things like that. One thing is that when you predict anything, and you may be held responsible, they may think maybe, like you said, rightly said, you may be, people may think you are a witch and things like that. So don't you think it's better we just keep quiet and pray about it? And also, now we talked about this COVID-19. Where were the researchers when these things came up? Where were they when people were dying? Could they not predict it? You talked about also predictions and so on. Didn't we predict it? Was there no way of, stopping it before it emanated to what it emanated to? So I don't know. I keep pondering about all these things. Did we go into hideout when these things happened? And then some people were dying, and those that were to even die were still alive. I don't know. So please, I don't know. Can you just talk briefly on it? Thank you very much, Prof. I'm grateful.
Thank you. Let me start from where you stopped. Talking about the issue of class at that point in time. Of course, you see, that is also, it's only that time has not permitted. That's also another aspect of what we study in public health. This social and the behavioral health. There's a course you're going to study in Texila. You call it social and behavioral health. That has to do with the influence of cultural, behavioral, and political factors influencing the discovery of diseases, our knowledge about diseases, and our actions about diseases. Don't forget, my sister, that when COVID-19 was discovered, people were not given adequate knowledge about it. People were not given adequate knowledge about it, probably because of, you can still recollect also, when the former president of the United States of America was talking, Donald Trump, when he was talking, he said this Chinese disease. And there was this stereotype that that is Chinese disease. There were several political issues associated with the discovery of COVID-19 at that point. So to the people in the United States of America, they had this belief that no, it's a disease of Chinese, so it can't come to this place. Until recently, in a way, you just look back and discover that even at his backyard, very many people have died. These are some of the issues that we also discuss in social and behavioral health. It's also an area in public health. The political aspect of it, of course, everybody knows, the competition, let me just use that word, between China and the United States of America. And that was why when this thing, in fact, even the China itself, China as a country has its own, initially maybe they thought they could address the problem. And then the information was not even made known to some part of the world. And of course, you can also recollect, my sister, the politics that went on, even in the so-called World Health Organization. So the reason that at a point in time, the United States of America had to pull out of WHO. Maybe probably the country is back now because they have another leader. All these politicking, all these factors, social and political factors, economic factors, we influence the spread of some of these, and that is what we saw specifically in the issue of COVID-19. Okay, let me set another example. Look at the case of Lassa fever that was discovered in Nigeria. TSP, just go to the Nigerian Center for Disease Control. The information we have there at the moment shows that Lassa fever killed more people than even the coronavirus that was widely celebrated. Why is the case of Lassa fever not widely celebrated like we celebrated? The issue is issues the Nigerians were raising at the time they were talking about COVID-19. This is COVID-19. How many people has COVID-19 killed in Nigeria? This is a viral. We have this Lassa fever virus. The infection is killing people almost on daily basis across the nation. And nobody is talking about it. These are that are associated with some of these things that we're talking about. Now, this prediction that we are talking about, don't forget, there's another issue you raised about prediction. When the first case of HIV was discovered, I think around 1982 or 83 in Kenya or like that, and then the thing began to spread. There were predictions at that time. At a point in time, between so and so period of time, so percent of the population will have been wiped out by HIV and AIDS, and then developing into AIDS. So those predictions actually trigger positive response from stakeholders. In fact, at that point in time, we got a grant, myself and my mentor, we got a grant to do what we call this social marketing of condom. At that point in time, when people were not even knowledgeable about this common ABC, tenets from unprotected sex, be faithful with an uninfected partner, and then consistent condomization. So we got a grant at that time, and they were moving from one place to the other. If not because of that prediction that actually triggered response, everybody was afraid. The whole world will be wiped out. The H will no longer contain people. And I am telling you, no matter how terrible the world is, it's on very rare occasions, 0.00 something percent that you see people committing suicide. People will still want to live here, and people will still be hopeful, and they are still optimistic that one day it will be better. That's the language here. So because of that prediction, you begin to see, people trying to say, no, me, I don't want to die. Me, I don't want to die. So some of the actions that were taken at that point in time actually yielded results. I'm not ruling out the possibility and the efficacy of prayers too. Every human being is spiritual. In whatever religion you belong to, you pray to God, and God can also help you. But as public health specialists, we predict to trigger actions, to tell the policymakers of the impending, danger that is that may likely, envelop significant proportion of the population. And so that was just in the case of HIV and AIDS, that was what actually triggered such actions at that point in time. And today, well, I don't know, there's some people are still talking about HIV and AIDS, but in this part of the world, in my own country here, almost everybody is knowledgeable about HIV and AIDS. And that is why sometimes a student of mine brought a research topic and said, no, I want to do a research. I said, well, what is your topic? He said, yes, my topic is knowledge about HIV. And I said, no, we have gone beyond that. We have gone beyond that level. In HIV and AIDS now, you cannot be talking about knowledge. Almost everybody is knowledgeable about HIV and AIDS because that actually triggers some, funds and grants and all of them released to NGOs just to go to communities and then be sensitizing people about the issue of HIV. The issue of science and the issue of science that you just mentioned, public health and science. You see, I just mentioned this because there is no time. There is a course you are going to do on this program We call it public health research. When you get to that, that is where the nitty-gritty of some of those things will be taught. Some of the scientific procedures of carrying out in public health is a course on its own. If you are a student of the public of the Texila American University. So maybe at this stage, let me just, I think I've been able to, okay, let me see some of these questions. What is more important, public health or environmental health? Please explain shortly. I've told you that environmental is an aspect of public health. Public health has to do with the population. In another panel, they refer to it as population health. The health, it is holistic. The health, the state of physical, mental, and social well-being of the population. A component of it is environmental health, and that has to do with you and your environment. The other time I was mentioning issues that have to do with personal hygiene and all those things. I need to tell students at times, even this health we are talking about, it has to start. Okay, that was when I was teaching them health policy. That's what we call personal health policy. Personal health policies have to do with the policies you put in place to effect or to trigger personal hygiene in your place. Some people after eating at home, they drop their plates inside the kitchen and you see flies flying all over the place. You can put up a personal health policy. Anytime, and if anybody is, because especially in houses where all these things are common in most of the developing countries. I'm starting examples from Africa, where in a family you can see, or in a compound you can see a man with about 4 wives, number of children there. They can be living inside the same compound and the children there can be more than 20. So if you bring up a health policy like eat your food and wash your plate, eat your food and wash your plate, it can be a personal health policy. By the time you bring it up, you cannot go to the kitchen and see any plate unwashed there. And some of these things and some other issues like that can be brought up at that particular level. So usually we get to, if we are talking about public health, you are talking about the general health, the health of the population. Environmental health is an area of public health. Whether one is more important than the other, I am telling you, there is no area of health that is not as important as the other one. Because if you are so careless in a particular area, just look at the one I just mentioned. There was a day I was in the class and I told the student, please, if law permits, or because there is no law that permits that, if law permits, I ask all this, I teach in a university where Sharia law is in place and you see most ladies, they cover their head. And I said, if law permits, then I ask all the ladies in this class to remove their hijab and let me see their head. It will take you by surprise. There are several of them who have not gone to make their hair, have not gone to play their hair, have not gone to play their hair for the past 1 or 2 months. But because when they go to the public, they cover it. I'm just citing that as an example. There could be a person, so as we look at that, that is as important as somebody even having a clean environment. So there is no aspect of health that one can underrate or one can undermine. Every aspect of health is very, very important. There can be a problem, there can be a challenge through what you eat. There can be a challenge through what you eat, through your environment, through where you live, through the water you drink, through your sexual behavior. So if you are very good in this aspect and you say, no, the environmental side, no, there is no aspect of health that is not as important as the other one. But the fact of the case, for this person to understand is that public health has to do with the health of a considerable proportion of a population, being a geography, maybe a set of people believe in one set of ideas and all those kind of things like that. While environmental health is an area of specialization in public that has to do with your physical environment and your health, the influence of your physical environment. So let me go down a bit and see. Yes, this person is thanking me. Thank you too for at least making yourself available for the lecture. Wait, yes. I think this is just attendance. This one, thank you, Professor. Thank you for this educative presentation. It's attendance. Yes, you have responded to my questions. Thank you so much. Grace, thank you very much. Just send me your email address after this lecture. I will forward the complete paper to you. I think that is all what we have here. And in the absence of some other questions, I wanted the moderator to just see how he can, whether he has any input or any question, whether he has any issues to raise. What the other side that I have not been able to explain better is the opportunity to study in Texila American University. And for those of you that went through a particular course in the Texila American, most especially the School of Public Health, you can attest to the fact that the school presents a very practical, a very realistic programs in public health. That this getting your education from Texila American University is one of the best opportunity anyone can have globally. The program is to an extent flexible. You have the opportunity of interacting with professionals, especially in your area of specialization, and that is the opportunity you have and that you are exploring now at this moment. I have told you if there are issues that you want to raise or you want me to address for you, I stand for Texila American University. I stand for the progress of the university, and I've been working with the university for a very long time, and I will continue to contribute in my own little way to the development of that particular university. And I think it is also important for you as students also to learn one or two things. So if there are issues, you can just contact me personally, and I'll be ready to address them. Thank you very much. Let me wait for the coordinator to make some comments, and if there are, and then to close this session. I appreciate everyone for coming, for getting linked up with this particular teaching, and I wish us best of luck. Thank you very much.
Thank you, attendee. Thank you very much for your patience. Thank you, sir.